Hello there, and welcome to my clinic. My name is Dr. Calliope, and I'm going to be performing your examination today. So if I could just have you confirm your name and date of birth for me. Is that your preferred name, and how do you like to be addressed? Excellent. From time to time, you might hear the office cat. I don't know if you saw them when you came in. We like to call them the terrible twins. They're always getting up to quite a few shenanigans. So, are there any other concerns you have for me that you'd like me to look at while you're here for this general examination? Oh, yeah. Right, so you've been having some headaches. Tell me a little bit about that. Mm-hmm. Mm-hmm. I see. So on a scale from 1 to 10, with 1 being not bothersome at all and 10 being the worst pain you've ever experienced, how do these headaches rank for you in terms of pain? I see. Well, we can certainly take a little look, and actually I'd like to address that first, if you don't mind. Wonderful. So from this point forward, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Mm-hmm. Wonderful. So I am going to take a little feel around your head. And in a moment, we are actually going to map out the boundaries of your headache. Unfortunately, there's so many kinds, and there's so many causes. And you may also be dealing with migraine as well. So we just want to try to get as much evidence as we can so that we can narrow everything down. Are you feeling any sort of pain or discomfort as I'm doing this? No? Good. Alright. So, I am just going to press around. If you could tell me where your headache starts and stops. Does it radiate at all? It does a bit. Alright, so I'm going to feel around. You just tell me when you feel where it generally is painful. Here? Okay, so it's almost like a hot and cold game. What about right about there? So how do these two spots connect then? Right in here, and then how far back does it go? Right to there. Good. I see. So this is a quite classical tension headache presentation where it feels like a taut band around the head, almost like a hat that is too tight. I'm going to come down a bit more, and tension headaches again, many causes, but oftentimes it's muscle tension. So how is right in here? It's a bit tender, right? And would you mind telling me, do you grind your teeth quite a bit? Perhaps at night or unconsciously so during the day? Not so much, right? And do you experience a lot of tension here in the temple area? Curious. So I'm going to do a little bit of range of movement testing with you. We're going to see if perhaps we can exacerbate that feeling and see if we can pinpoint, maybe we're dealing with a pinched nerve or we're dealing with a muscle being a little goofy, right? So if I could have you just bring your head all the way back. And how does that feel? Alright, and bring it all the way forward if you can. All the way forward. Try to touch your chin to your chest. Good. And how was that? Let me just feel a little bit in here. Since the structure of the neck is a little different, the muscles have different positioning. How is that? Okay, and if I could have you bring your head to neutral and go all the way to your left and all the way to your right. Good, and how was that? Right, and if you could tilt your head to one side and the other. Good, okay, and that's not painful either. Alright, so we have a little bit of a persnickety case here. I'm going to try one last thing. I am going to just put my hand on your head and I'm going to have you move against it while I try to resist your movement. We're just going to test the muscle strength, and sometimes that also makes any muscle tension become a little more prominent. I'm going to put my hand on the side of your head. And if you could just move your head aside. Good. And then you could just move your head to the other side. Good, good. And how was that? So I think since this is rather new, and so far I'm not getting a whole lot of information about it, so I'm going to have you keep an eye on it, and the next time I see you, we can make an appointment for a few weeks from now, maybe a month, depending on how you feel about it. We can try to investigate this a little bit more. We've done a lot of looking at the head, which helps to fulfill that portion of the general examination. So we are instead going to move to your eyes. So I'm going to have a look at the eyes, around and the different tissues of the eyes, the tear ducts, the sclera, the orbital ridge surrounding the eye, the eyebrows, eyelashes, beautifully colored iris. Now I'm going to be just pulling down on the eyelid, and I'll have you look up. Just going to pull down and look up. Good. Good. The other eye. Just going to pull down and you look up. Very good. Good. And I'm going to pull up on the eyelid. I'm going to have you look down. Pull up and you look down. Good. Good. And the other side. Pull up and you look down. So we have just a light pink conjunctival tissue. Very good. And you can blink a few times if you need to. Good. And let me grab my light. We can check the pupillary response. I could just have you look at my nose here. Good. I'm going to bring this in real close. Good. So the pupils should be equal, round, and reactive to the light. They should also react in the same way at the same time when a light comes into the field of vision or out of it. They are synchronized. Good. Keep looking at my nose. Good. You see the dilation and constriction. Dilation and constriction of the pupils. Just keep looking at my nose. Very good. I am going to look at each individual eye and assess the ability for them to move. So, look at this eye first here. So if I could have you look up. Look down. Good. And look to your left. Good. And look to your right. Good. The other side. If you could just keep looking straight ahead as far as you can detect. Good. Good. If you could just follow this light using only your eyes without moving your head as it comes in and out. In and out, in and out. Very good. I'm just going to go turn the lights back on. Moment. You can blink a bit, let your eyes get used to the light again. I'm going to do one last test for your eyes, in which I'm going to have you look here at my nose. And I'm going to have you tell me when you see my fingers wiggle. Alright? When you see my fingers wiggle, you can just say yes and hold up a hand, whichever you would prefer. Just keep looking at my nose here. Good. 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 Yep. Yep. Good. Yes. Yes. Good. Very good. Excellent. So, let me grab my otoscope here. Get that ready. We'll take a look at your ears. So, have you had any particular issues with your ears as of late? No. And if I do a bit of palpation here, any pain or tenderness? No. Very good. And on the other side here. I'll do a bit of both. Good. be moving on to taking a peek at the nose, mouth, and throat, just briefly. If I could have you just tip your head back. Good, we'll look inside of the nasal passages. Good, those are clear. And if I could have you just occlude one side of your nose. Yep, just hold one of the nostrils shut. And you can just take a few deep breaths. How was that? Good, okay. There's no issue with breathing at all. If you could switch to the other side and cover the other nasal passage. Just like that. It's just fine. Good. How's your sense of smell? Not any different than any other time. Yeah. That's good. Let's take a look in your mouth and look at the inside of your throat. Oh, you could just open your mouth as wide as you can here and take a little look. Good, I'm just going to pull down the lip here and pull up. Good. And the teeth look healthy. If I could have you just lift your tongue to the roof of your mouth. Good. And if I could have you stick your tongue out of your mouth as far as you can reach. Flatten the tongue. And I'm going to look at the uvula and the tonsils if I can see them, if they're present. And the throat wall. Good. Alright, and if you could just say ah for me. Very good. You can close your mouth. And now I want to do a few sensation tests with you. Facial sensation is governed by the trigeminal nerve, which is one of your 12 cranial nerves. It also has some motor functions, but we're going to focus on the sensory function. A little cotton bud here, and I'm going to pull out the cotton a bit so that we have this little wisp. And I want you to just tell me when you feel this little wisp here. Going to touch the skin. Let me know when you feel it. I'm going to test it on your jaw here. You feel that? Just barely, yes. That is what we're going for. Just let me know when you feel the cotton bud. Good. Good. Some of these areas are not strictly governed by the trigeminal nerve. It's more your sides of your face. Have the ophthalmic, maxillary, and the mandibular branches of the trigeminal nerve. Good. Good. But some of these are just a little fun. Good. Now, we are going to do a different test that is somewhat similar. I have a dull object here, and I have a sharp object. Now, this is a toothpick. It's not going to hurt or break the skin at all. It's just going to be sharp versus the dull surface. I'm going to test this on your jaw. I'm going to tap these. So this is the dull. This is the sharp. Alright? So just let me know which you feel. I'm going to tap them on the skin. Let me know if it's dull or sharp. Right? Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Good. Now lastly for the face, I have a tweezer here. This has 2 prongs, and I'll be using the little pointed ends so that we can test your 2-point discrimination. I'll be asking you whether you feel 1 or 2 touches from the tweezer. You might feel just the 1, you might feel 2, right? Wonderful. So, about right. 1, 2, 2, 1, 2, 1, 1, 1, 2, 2, 1, 1, 2, 1. Very good. So your 2-point discrimination is very good. Easily discernible. I'd like to check your lymph nodes. I'm going to start at the back of the head. Look at the occipital nodes. Then the post-auricular behind the ear. Pre-auricular in front of the ears. Down a little for the parotid gland. Submental and submandibular under the jaw. Superficial cervical, deep cervical chain, and posterior cervical on the neck. And supraclavicular above the clavicle. Good. If I could have you just put your left hand here on my right shoulder. Good. I'm going to just feel the axillary nodes under the arm here. Good. Right, and if you want to switch hands, yep. Good. Just feel around in here for a moment. There. I'm going to take your arms and I'm going to feel the lymph nodes in the arms. Now, ideally, these actually shouldn't be felt very much. They're quite hard to get to. So if I don't feel anything, that's a good sign. Here we go. The other side. Good. Right. If I could just see your hands. Yep. You could put your palms to the floor. I want to look at the nails, at the joints. Good. Any pain as I'm palpating the nails and squeezing the joints? No. Very good. If I could have you flip your hands over. Okay, muscle bulk looks good, as well as the skin, the color. Hands are dry and warm. Good. And have you had any problems with your joints, with range of movement? No? Okay, very good. So I am going to do a little test here where I am going to hold your finger either up or down. We're going to test your position sense. And you just let me know whether you feel your finger up or down. Right. So if I could see your fingers here. And just let me know whether it feels like it is up or down. Up or down. Right, so down, down, up, down, up, up. Other side. This is up, this is down. Right. Down, down, up, up, up. Very good. All right. So I'm going to take a listen to your heart, lungs, and abdomen. I'm going to start with the heart. So if I could have you just breathe normally here. I put my stethoscope right on our aortic area, the superior aorta here, and the pulmonary valve. Good. Tricuspid valve area. And the mitral. Good. Now I'm going to listen to your lungs. I am just going to have you take a deep breath in when I put the diaphragm on your chest, and I'll help you with the rhythm of that. So take a deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Good. Deep breath in and out. Deep breath in and out. deep breath in and out. Good. We'll move to the abdomen. Just breathe normally here. And this is just a couple of seconds per listen. I'm just going to go all around your abdomen. Good. So I will be listening to your lungs at the back as well, but I'm going to palpate around your abdomen to start so that we don't have to double back. So tell me if any of this is painful or tender at all. I'm going to start with one hand. Oh, good. And then two hands. Have you take a deep breath in and out. Deep breath in and out. And that should be it. There's not actually any need for you to breathe deeply, but it can be a little uncomfortable. So I found it helpful to have the patient focus on something else. I'm going to go around to the back and listen to your lungs. Just going to pop my stethoscope back in. And if I could have you take a deep breath in and out. 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 Last one. Deep breath in and out. Good. Come right back down. There we are. Not too much left here. I'm just going to take a look at the lower extremities. I'm going to take a look at the legs and the feet. With the toes here, I'm going to check on capillary refill, just like the fingers, as well as feeling around the joints. Any pain or discomfort here as I'm squeezing the joints? Oh, very good. Very good. Right, and I am going to just look around the sole and the top of the foot. And these are also warm and dry to the touch. Very good. And the last thing I'm going to do is I'm going to check your patellar reflex with my Patellar hammer here. It's just going to be a couple of quick I'm going to have you let the leg hang loose. Let it go limp. Let it relax. Good. And I'm just going to give it a couple of taps. And the other leg here. Let it go limp, loose. There we go. Excellent. And that will about do it. Did you have any questions at all? Any concerns? Very good. So, the only thing I have for you, a spot of homework really, is I want you to keep track of your headache symptoms. And what this means is I want you to record time of onset, time that it goes away, if anything makes it better, if anything makes it worse. You might even include things like what you've eaten that day, in case for some reason there's something not agreeing with you, some sort of an ingredient that is kicking that up. You might tell me a bit about if you have other symptoms. Maybe we're dealing with allergies, or maybe it's tiredness, fatigue, that sort of thing. Just anything you can think of that may or may not be relevant. The worst we can do is just disregard something. But if you could just keep a log of that. Alright. Anything else? So I'm going to sign off here. And that will conclude our examination. I'd like to thank you again for coming into my clinic, and I hope that you had a pleasurable experience. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything, from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation, or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day.